Well, good morning. Hope you're having a great start to your day. And as usual, we'll wait for a few folks to come on this morning and I'll say hello. Nick, you're the first one up from our staff, at least that I see. And Nativity, good morning to you. Eileen is watching, and so is Rosalinda from Niagara Falls. From Elgin, Illinois, our dear friend John. Derek, Mary, good morning to you. We appreciate you guys so much. Elaine, good morning. Sandy and Wendy, dear friend from Markham. Kim from Timmins. Good morning, Kim. Maria and Jocelyn from Sturgeon Falls. And Denise. Bruno, good morning to you. And Lara, hi Lara. Denise and Louise, Chandra, and Kevin from New Brunswick. Good morning. We appreciate you guys coming on. Linda and Kathy, Jeanette, faithful followers. Carrie, good morning. We appreciate it. Another Linda, Natalie, and Luella, Ruby, and Donna. Good morning, Donna. Beth, Renald, good morning. And Marsha, Gail. Well, we got a good crew on, and as usual, we'll say hello to you guys and appreciate you. Suzanne and Etta, Yolande, good morning. Doc, our dear friend Dr. McEwen from Tennessee, and another Donna from Bell Valley, Netchel, and Maria, Jeanette. Okay, Elizabeth. Guys, I want to talk to you about pancreatic cancer this morning. The reason I do that is because some statistics came out from the latest statistics on it are out of 2018. So this is 3 years ago, but they actually just published this. In 2018, this is pancreatic cancer is one of the most deadly cancers. We'll explain why in a minute. We'll explain not only why it is so deadly, but we'll explain why it is so prevalent. And this is what this study was saying, that there was over 500,000 new cases of pancreatic cancer in the USA alone in 2018. It is one of the most deadly cancers. And it's a terrible thing. I mean, it really is. I don't know if you've ever known anybody that's had pancreatic cancer. The chances of any kind of recovery from that are almost nil. Now, let me explain the pancreas. Remember, I mentioned this yesterday. Like, the pancreas is the size of a ballpoint pen. Okay, so you see this pen? It's just about the exact size of your pancreas. And your pancreas, guys, okay, let me just see if I can get a picture of it. Here, I do have one. Okay, so I'm just pulling out, for those who are listening on a podcast later, of course you won't see this, but I'm pointing out the pancreas here on Facebook Live, and you can see the stomach here, and the pancreas just about covers the entire bottom of the stomach, okay? And so the problem with the pancreatic cancers and what makes it so deadly is that it's usually never detected until it's too late, until it's rapidly advanced. And with very few symptoms, although I'm going to talk to you today a little bit about what some of the symptoms, early symptoms of it, and you should be concerned about it. And then we'll talk about how to prevent it, okay? So your pancreas, you sort of have what they call an endocrine part of it and an exocrine part of it, okay? So your pancreas does two main things, okay? So just follow me on this. One, it releases enzymes through the ducts. So if you see this, again, I'm just going to show the chart of diseases of the digestive system. I actually got this in the 1970s. I've still kept it because I still like it. Okay, there's atlas here, but the problem, okay, most cancers of the pancreas occur in this area here, just underneath the stomach where the ducts are, because what's happening is that the pancreas, one of its jobs is to release enzymes to facilitate digestion, pancreatic enzymes, and they're sent into the small intestine, okay? So again, picture small intestine here, okay? And from the stomach here, and the pancreas releases through the duct system enzymes into that area in the small intestine, because in the small intestine, which isn't that small, by the way, but it's wide. It's wider than the large intestine because the breakdown of food, of course, starts right in the mouth, but then into the stomach. You need a very acidic pH. You're breaking down food. It's turned into a mulch in your stomach, and that liquid is sent in to the small intestine, and the small intestine is where your absorption, because of these enzymes coming in to the small intestine, they're like Pac-Man. They break down the food so that you pick up all your nutrients, and your nutrients that you need are sent into your bloodstream, okay? So you have that part of your pancreas, okay? So it releases enzymes. Okay, so you're familiar with digestive enzymes, the pancreatic enzymes. Okay, so one. And then secondly, the one that you and I talk about almost every day without exception is insulin. So the pancreas releases enzymes and insulin. Now, the pancreas does a few other things, but for the sake of teaching, if you remember that, you really got it, okay? So numero uno, enzymes, digestive enzymes, released from the pancreas into the small intestine. And number two, insulin. Every time you eat, you need insulin. When you eat crappy carbs and sugars, you need a lot of insulin. Okay? Now, coming back to pancreatic cancers. Pancreatic cancers, the vast majority, over 80% of all pancreatic cancers occur in the area of the pancreas that releases the enzymes. Okay? It occurs in that area of the pancreas that releases enzymes. And this is one of the reasons it can be so deadly because, first of all, it's hard to detect. It's hard to detect. Pancreatic cancer is very hard to detect because you're not looking for it if you have no symptoms. Okay? So, again, then that's generally true in medicine, generally, right? They're into not prevention of pancreatic cancer. They're into early detection of pancreatic cancer. But in that area, it's been a dismal failure because pancreatic cancers are usually found in their late stages. Rarely ever find a tumor. And again, I bring you back to the ballpoint pen. So not only am I showing you the size of the pancreas generally, and I talked yesterday about the ink in the pen representing the insulin, and you never really completely run out of ink like a pen does, but your pancreas, if you're secreting insulin all the time, when you secrete insulin all the time, you're overusing it. Now, remember what I've talked to you in the past. For those who are watching for the first time or you're new to this podcast, what I am showing now is a ballpoint, the tip of a ballpoint pen. You see that little tip? That is the size of cancer after 5 years. Because people have this idea in their head. And I've done a lot of TV shows over the years. I had a publicist for several of my books, and I would do the tours of TV and radio. And I often, when I went on TV, you know what? I learned something having my own TV show. You want illustrations. People like illustrations. So I often would bring my ballpoint pen and I would show them. And I'd get the cameraman and said, come here. You see the little tip of the ballpoint pen? That's how long cancer takes. 5 years to get to the tip. That size. I said, ladies, when I was talking about breast cancer, ladies, you see that? How the heck are you going to feel that in your breast tissue? You won't feel that. And generally, even a mammogram won't pick it up. And if they do, it's 5 years old. It's 5 years old. And most people, you fight cancer cells every day. That's what you know what we've lost touch of? And just a little side trail for a second, which drives me mental. In this whole virus thing, we don't talk about the immune system. Your body knows that there's something going on here. It's attacking it. And we'll talk about, things that will attack a tumor. Somebody asked on Question and Answer Friday about polyps. You've heard of polyps in the colon. And you get a colonoscopy. And the doc says, I saw a polyp. I took it out. I sent it to a lab to see if it was cancerous or not. Okay? And again, that's early detection, not prevention. It's not prevention. The cancer industry it doesn't talk about prevention. It talks about early detection. And I think that's a huge mistake. Because by the time they detect it, and I talk to you about breast cancer, ladies, but prostate cancer, men, and pancreatic cancer, it's when you talk about early detection, it's 80% they're showing is already has metastasized. So early detection for pancreatic cancer it's not the stats are not good at all. It's a rising cancer, pancreatic cancer. And you guys, even if you're just thinking for a moment, you know why we see so much pancreatic cancer. So much of it. But guys, I'm more into teaching you how to prevent. I'm not against early detection. I'm not. But it's not really what we should be emphasizing, because the world should be looking at preventing cancer. Not just, we found it, now let's treat it. And the treatment for pancreatic cancer has been an abysmal failure. It really has. They just, because they can't find it in time. It's usually metastasized, and it's a deadly, deadly cancer. Pancreatic cancer. On the rise today. Coming to a theater near you. And, just by simple deduction. Why are we seeing so much pancreatic cancer? Number one reason is sugar. It's sugar. The pancreas has been overused. And when you eat crappy carbohydrates, and this is one of the reasons I set up the reset, when you live on crappy sugars and carbohydrates, you're wearing out that pancreas in two ways. Insulin, which gives you insulin resistance. We talked about that yesterday, that people that suffer from insulin resistance, the ones that are in the top third, got all the diseases, including cancer. And the ones that hardly used or didn't have any insulin resistance, how do you stop insulin resistance? How do you stop it? It's not eating less, guys. It's not eating less. Oh, if I eat less, I won't overuse my pancreas. No, it's changing fuels. It's changing fuels. It's a switch. There's nothing that will help you. Nothing that you can do more for yourself than switching fuels. And very few people are talking about it. I read this study on pancreatic cancer, and how prevalent it is and how deadly it is. And for heaven's sakes, in the article, they weren't even talking about food at all. The first thing you need to do, switch fuels. You know how I always talk about the pancreas going on a holiday to Hawaii? Give your pancreas a break. And even in the area, because I told you about the two areas, one of them is insulin. And if people insist on eating junk, they're going to wear out that pancreas, not only to give you diabetes, but to make you much more susceptible to pancreatic cancer. Now, one of the reasons, Like, this is important too, because remember, I talked to you about there's two parts to the pancreas, and actually where you get the cancer the most is in the enzyme secreting part of the pancreas, the pancreatic enzymes that are lipase and amylase and protease, and they're sent into the small intestine to help digest your food. Why do we see so much digestive problem? Because you see, guys, this is what I want to talk to you about. One of the signs, early signs that something is run amok in your pancreas, the pancreas is affected. It's starting to be affected in that area of enzymes is when you have digestive issues, symptoms. I've said this in the past and I'll say it again. In my opinion, when I talk about SIBO, which is not really SIBO, small intestine bacterial overgrowth, you guys heard of this. And you and I changed the name. Remember, we had a vote. Okay? And we decided, well, I probably pushed you a little bit, but we decided to call it SIFO, small intestine fungus overgrowth. When you get an overgrowth of fungus, candida, yeast in the small intestine, that is one of the greatest cancer producing, not in the small, it could cause cancer in the small intestine, yes. But that's not what I'm talking about mostly. Where it will cause cancer, SIFO, okay, we'll talk about this in a second, is in the pancreas, where those enzymes come down the duct into the small intestine. When you get SIFO, how do you get SIFO? How do you get SIFO? How do you get an overgrowth of fungus in the small intestine? Well, you can have low acidity in your stomach. Your pH, you got a stomach, you're a crappy eater, and your pH in your stomach isn't acidic enough, and yeast can come in from the inside, but also you get it from leaky gut. I'll tell you one of the biggest problems in society today, the two-edged sword, is the overuse of antibiotics. They wipe out your good bacteria. You get an overgrowth of fungus, yeast. Yeast, think about what yeast does. You want to make bread rise? What do? Yeast. It makes it grow, grow, grow. And in the small intestine, fungus will overgrow. I know they say it's bacterial overgrowth. Yes, there's bacteria there. But I've always said it. It's like the urinary tract in women. You get recurring infections. It's not the bacteria is there. But the wall of the bladder has become coated with a fungus, moisture, yeast. A woman's private parts. Think about it. There's a lot of moisture there. Fungus sits and it'll the body, the bacteria and E. coli or whatever can sit And, you take an antibiotic. What? Of course, you got pain. You have an infection. The doctor said, here's an antibiotic. You know how many people take antibiotic, even kids? Sinus infections and throat infections and ear infections, and all of it was viral. And mommy, of course, baby's screaming. But it sets them up for a fungal overgrowth, not only in the sinuses. It can happen in the gut. And I'm telling you, in my opinion, it's the number one reason for the excess in pancreatic cancers. Numero uno. Numero duo. Okay? 2 is the garbage diet. Because guess what yeast feeds on? Sugar. Yeast is like a teenager. What does it want? Feed me, feed me, feed me. Sugar, sugar, sugar. I was in a coffee shop the other day, and a kid in front of me, like a teenager, ordered one of these, it wasn't coffee, one of these drinks. Oh my word, the amount of sugar. I watched the barista go, he must have put 12 teaspoons of sugar in there. I felt like, tapping the kid on the shoulder and saying, why don't you just have sugar? I mean, why just say, can I have sugar, please, in that cup? And maybe put a little bit of coffee in it or chocolate or whatever just to flavor it. My word. But guys, you have no idea what that does to yeast. Yeast goes, whippy. You feed me. Thank you. Cancer cells go, thank you. I appreciate it. And now I'm going to grow, grow, grow. That's what happens. It's not a mystery. It's not a mystery. It's not genetics. Medicine wants it to be genetics so they can find a drug. It's not genetics. It's food. It's food. So, what do we do? What do we do? Change fuels, obviously. Change fuels. Don't feed the bears. I know that seems simplistic. I know. Cancer's complex, Doc. Yeah, I know, it's complex. But the basic units, the basics, is don't feed it. It wants fuel. Cancer needs fuel. Yeast needs fuel. Remember Dr. Simoninci in Italy, an oncologist. I have told you this story more than a few times, but I'm a repeater, right? But I was on a TV show with him years ago. I'm talking about in the early 90s. And I was talking about chronic fatigue syndrome. I had just written a book. And he was talking about cancer, and he said all cancers are fungus-based. They're yeast-based. And he was an oncologist. He wasn't no dummy. And he said, I look at cancer under a microscope, and there's always fungus there. It's yeast-based. He said, we got to deal with that. Interesting, isn't it? I never forgot that. I was telling him about, and he found it interesting about chronic fatigue syndrome. And so often they're full of yeast, full of fungus because of antibiotics. I mean, that's 30 years ago. 30 years ago. So guys, when you read that pancreatic cancer, a deadly cancer, there's almost never an early detection to it. You need to prevent it. Change fuels. Don't feed the bears. If we can convince people, if they do nothing else, you see, eliminate sugar. That's not easy. The world we live in, I understand that. It's craziness. But it doesn't matter over the years how many thousands of cancer patients I talk to that would come to me once the diagnosis. Listen, I'm all in. You're in for the fight of your life. I wish I would have met you years ago so I could change your diet. But now what do? Don't feed it. Don't feed it. Don't give it fuel. Don't listen to anyone that tells you that sugar in moderation is good for you. Don't you believe it? Not for a minute. Okay. By the way, here's some statistics. Here's some statistics on pancreatic cancer. Okay. If you're a diabetic, ta-da! If you're a diabetic, here's a fact on pancreatic cancer. Hot off the presses. 4 to 7 times more likely to get pancreatic cancer if you're a diabetic. Hello? You know what bothers me about diabetes? Here's what bothers me about it. It's a food problem. 1. 2, it's 100% preventable. It's an allergy. I talked to you about that yesterday. To carbs. Diabetes, if you're a diabetic, according to statistics, you are 4 to 7 times more likely than the rest of the population to get pancreatic cancer. Yeah. Of course. It's impossible to become a diabetic unless you're a carboholic. It's impossible. I'm not talking about type 1 diabetes, which is autoimmune. I'm talking about type 2. A scourge on society today. Lose weight. Lose weight. It's effective to decrease pancreatic cancer. I'm just reading some research here. I agree with it because you see, I'm showing here, again, for those on a podcast later, you know what I'm showing? I'm showing fat here, okay? A pound of it right here in my hand. You know what this fat does? It releases estrogen. And estrogen, I know it makes you a woman, makes a man a woman too, but it makes things grow. So when you lose weight, it helps. And the healthiest weight loss program is the Reset. Wasn't created primarily for weight loss. but it's the healthiest way. You're not starving. You're changing fuels. Curcumin. Study after study has shown that curcumin is very effective in the treatment of pancreatic cancer. It's not talking about a cure, but I love curcumin. I love that Indian spice. And turmeric is good, but the problem with turmeric is curcumin is an extract of turmeric. The problem with turmeric is it's poorly absorbed. I mean, to get the benefits, the curcumin. So curcumin in terms of studies, is very, very effective. It's very anti-inflammatory. It's very anti-cancer. I like chromium picolinate. I use it in my insulin balance. Vitamin D. Vitamin D, of course. Viderma. There was a new study out this morning on Viderma. Oh, it's so good. It's so good. I'll bring it to you, I think, probably in the next few days. Here's another one. Vitamin C. Pancreas. Coffee. It's good for your pancreas. I've always told you about that, right? Coffee acts like metformin, guys. There's another new study came out about coffee. And of course, this morning, when I read it, I go, woohoo! Because you know me, I love coffee. It's the real vitamin C. It is. It's the real one. The other one's not real. Ascorbic acid is not the real vitamin C. You know that. You guys know that. It's all right, but it's not as good as coffee. I hope you love your coffee. No sugar, please. DHA. High DHA. Again, they're showing. Omega-3. But the DHA, the longest chain fatty acid, and there's some studies on how effective it is in preventing pancreatic cancer. Right? Pancreatic cancer. Probiotics. You want to kill that fungus. Kill that yeast. Don't feed it and kill it. Kill it. Probiotics. Broad spectrum. L-reuteri. L-rhamnosus. The two that I love those two ones together because they go after candida and yeast and fungus. Okay? So you want that. Okay. Did you have fun? Okay. So, guys, we appreciate it. Crazy, eh? About pancreatic cancer and how aggressive it is and that. So I hope that little teaching this morning helped you. Okay? Because I'm into prevention, guys. I want you and I to prevent these things. You know? I'd rather you not get them. And if you get them, okay, you put everything on your side to win the battle. But I thought I'd just give you a little clarity on pancreatic cancer and why it's so prevalent today. Okay? So, again, thanks for watching, guys. We appreciate it. You have no idea how much we appreciate it. Tony Jr. and I talked about it yesterday, and we love our folks. We love you guys for your consistent following. And we appreciate that so much. Get your friends, if they haven't joined the Martin Clinic Facebook group, to do that. It's a private group. What a great community. I'm telling you, it is wonderful. It is a great community of our folks. And there's a lot of good recipes, feedback, and stories. And I love it. It's great. Friday is Question and Answer Friday, one of our most popular programs. is the Friday program, question and answer. People like it, and I like it too. It allows me to rant. I love ranting. I do. Okay, guys. Love you dearly. Talk to you soon.